Hey everyone, welcome to Founders Live Conversations. I am Nick Hughes. I'm the founder and CEO of Founders Live, and so excited today to actually cover and talk about, healthcare 101 for entrepreneurs and founders and startups. So excited to have Melissa Blatt, the CEO of indipop. She is joining us to talk all about how to approach your healthcare needs, how to fulfill the needs that, especially as an early stage entrepreneur, there's a lot of questions around here. So Melissa, welcome to the conversation. Excited to have you.
Hello, all the people out there in Founders Live. Big fan of Founders Live. Thank you, Nick, for starting it.
Awesome. It is great for you to be here. And as people you're joining in, if you just joined in, hey, we have a group chat in here. Feel free to share your information. That's also a great place to post questions. We are definitely going to take your questions today. And this is a group conversation. This is a group thing. But Melissa, it is awesome for you to be here. So let's just, slide into this conversation. It's been amazing that you've been a part of our community and our, ecosystem for a while, and I have been a part of yours. We'll cover that in a short while, but introduce yourself, say hi, and how did you even discover Founders Live? How did this partnership even come together?
Pre-COVID, when we were still meeting in person before you guys went virtual for your pitch competitions. I actually pitched with Founders Live here. I'm in Phoenix, Arizona. We serve all 50 states, but headquartered, I guess, in Arizona. And you want a little bit of background of how indipop came into being?
Yeah.
So in about, it was like 2018, I left the corporate world and
Whoa, sorry.
Did I already say something wrong, Nick?
No, I am sorry. Let's feel free to start over on that. But I was muted somewhere else. So go ahead. Sorry.
No, so in 2018, I left corporate. As many of you may know this, when you are out on your own as a self-employed person, you're now a 1099 contractor, or you might have an LLC or an S Corp, and you are responsible for finding your own healthcare. And it can be quite expensive when you get older. So I, went into the healthcare marketplace, and that's when I had kind of the sticker shock of, wow, not only do I have to spend like $500 a month, but I also have this huge deductible of $8,000 and a limited network. And it got me thinking, wait, I am not alone. This population, we make up a third of the workforce. This is huge population of people that are self-employed or have small teams that they're trying to do the right thing and provide healthcare. And it can be very, very expensive. So I said, if I can find a solution for myself, I'm going to share it with an entire population of people. And that's what I did. And so now, fast forward 3.5 years, we have 5 major medical hospitalization plans and dental and vision and all these other things that I'm sure we'll get into. But it is, we're here for you. We're here to help you as an additional resource while you're going through open enrollment and trying to build your business. Healthcare is not a sexy subject. If I mention the word deductible, people zone out. And so we really try to help educate you in knowing what to look for in a plan, in addition to what we offer here at indipop for our options and solutions.
Yeah, that's awesome. And, again, everyone, group conversation, we definitely would like to hear your thoughts, questions. Feel free to, you can raise your hand, digitally raise your hand or type them into the chat. So we're excited about that. But, Melissa, it's amazing because, again, I'd love to go into kind of founding stories as we wrap into this full conversation. But you saw a problem and you experienced it kind of firsthand. And how amazing. I guess one of the things is it's crazy. Were you ever shocked that you're like, oh my God, I'm actually starting this, I'm getting into this industry, this is crazy? How did you
No,
go?
I didn't. You're right, because I'm literally going up against healthcare.gov and Blue Cross Blue Shield and United Healthcare, and I'm really to be honest, I don't consider it competition. I consider it, they're an option in the market, we're an option in the market, and you have to find the right fit. And it's not a one size fits all in healthcare. It's very personal. And a 26-year-old is going to have a different need than a family of 5. So there needs to be, there needs to be options, and there needs to be affordable options.
Yeah, yeah. Well, let's walk into that. And what are the options for, and especially we're talking about, entrepreneurs, solo business owners, and a lot of times it's a little I guess it can be opaque and confusing. Let's actually walk into, when someone is actually evaluating this, maybe they've left their big, corporate job and they're like, I am starting a company. And then that's like, oh shoot, what about healthcare? How should someone go about that? Or what are the options in that,
Yeah.
And we'll go into like the details here.
So there are, and it also depends. So with your ACA plans, those metal plans, the bronze, silver, gold, platinum, they are going to be based on where you are, how old you are, and your earnings, because you might qualify for a subsidy, which will lower your premium. A premium is what you're going to pay monthly. That's your monthly rate, and the premium is what they call it. And as long as you keep up with your premium, you're actively enrolled. If you stop making it, they could say, we're going to deny, you're not active anymore. And so you're going to look at what can you afford monthly, right? But then you've got to look in the middle of the plan, not just what you can afford monthly, because you do want to get into a situation where you go to the ER for a migraine and you end up with a $5,000 bill. And that is where you just need to, I'm going to go over several things, like 3 things to look for that we've seen in plans that people are surprised they didn't know. Ready?
Perfect.
Okay.
Yeah.
So I mentioned the ER. So some plans might have a copayment. A copayment means you're going to pay a certain amount at the time of the ER visit, 250, 500, it'll say it in your policy, ER visit, copay this amount. But you want to look at if you have a copay plus coinsurance. So co-insurance is where you're splitting a percentage with the insurance company. So it could be 50-50, it could be 80-20. And so you might owe $500 at the time, and then it might be 50% of the bill capped at something. So that might be your deductible or your max out of pocket. So let's talk about a deductible. A deductible is the amount you're going to pay before the insurance kicks in. So if you have a $5,000 deductible, you're going to be responsible for that. And then the insurance company is going to kick in and pay the rest. So if you have a $50,000 medical bill, you're responsible for $5,000. I hope I didn't lose anyone right now. I know it's not exciting, but this is the stuff that if you're educated on, you're going to hopefully mitigate a surprise bill. So if you have in an ER plan, in your ER for the ER, just a deductible, that means when you go to the ER, you're going to owe your deductible. So the higher your deductible, the more you might owe for an ER visit. So we've seen a couple of plans where they don't have a copay, they have a deductible. So that is just something to be aware of. Another thing to be aware of is where the coinsurance is throughout your plan. So this may be you have a deductible of $5,000 and you break your leg and you reach your deductible of $5,000, and now you think, yes, zero for the rest of the year. I reached my deductible. Well, look to see if you have coinsurance, because you might owe 50% or 20% of your medical bills for the rest of the year up to your max out of pocket. So your max out of pocket is going to be the most you're going to spend in a calendar year. It could be 10,000 for a family. We've seen 32,000. And then lastly is networks. So I'm going to just quickly go over what a PPO and an HMO is. So a PPO is where you're going to be able to have a primary care doctor, and they do not have to refer you to a specialist. You can just book time with a dermatologist or a gastroenterologist or whatever kind of specialist you would like to see. An HMO, you cannot do that. You have to go through your primary care doctor. They're the gatekeeper. And so it's a little less flexible. And that's why HMOs are a little less expensive than a PPO, because there's more procedures to go through. So if you have a max out of pocket for your calendar year, you want to make sure there's a cap for you guys, because if you go to an out-of-network doctor and you don't have a cap for that, you're going to be responsible for it. So it could be 21,000, 50,000. So for your max out of pocket, you want to make sure you understand your network. And then you want to make sure that you have a cap. And lastly, if you're in an emergency situation, I don't know if anyone goes skiing out here or you're into sports or anything, and it's an emergency, you break your leg, regardless of the network with insurance, you should not be responsible for going out of network if it's an emergency. If it is a planned surgery, you better make sure you're in network. So those are the tips. Wow, thanks for letting me just like breeze through those. Does anyone have any questions? Like, did I mention anything that somebody wants me to dive into a little bit more?
Yeah, this is good. Well, Lauren has one, and actually,
Okay.
this is definitely along the lines of one of my next questions in some ways. So, thank you, Lauren. Is indipop an insurance company like Aetna or a broker insurance company? So, maybe the best way to do this is, let's even slide into cost sharing. How is that different from
Yeah.
insurance, and really, what does indipop provide specifically?
Yeah, so indipop, it stands, by the way, for independent population. That's the name indipop. And we're all the people not getting healthcare through an employer. And it's a marketplace. So we have a marketplace of cost sharing, and I'm going to go into cost sharing is just an alternative to, or another approach to managing your medical needs, kind of like insurance. So insurance, you have a premium and a deductible. With cost sharing, you're becoming a member of a group or community that shares the cost and medical needs. So it's a little more flexible. I'm going to have to get my dog a treat. Sorry, guys. She's not going to leave me alone.
Oh, the dog.
Got more questions?
Yeah, I'll even step in to just share a little bit of thoughts around, the great thing about indie pop and independent population. As we as Founders Live got to know Melissa and indie pop, this is why we brought it to the community, because it fits perfectly with kind of entrepreneurs or early stage companies that do feel more of the independent aspect. All right, let's come back.
Yeah, so cost sharing. So I didn't know about cost sharing when I literally learned about it because I was so stuck. I was not going to pay the $500 for a plan that was just not acceptable. I want quality. I don't want it just because it says it's healthcare. I really, unlike car insurance, most people use their healthcare throughout the year. We get, go to urgent care, we get shots, we do things with it. So it was important to me that I had quality. So when I started researching and I was introduced to this concept of I become a member of a community that shares the cost of medical needs, so my premium becomes a membership. So our plans work in all 50 states. A lot of the cost sharing plans do work state to state. So that's very different than insurance, where your insurance plan might work in 14 states. But if you go out of your state, it could be considered maybe out of network, especially if you're on an HMO. So you just have to be careful. Another thing, I know Nick and I talked about this, and something that he likes about it is it's really portable, so that if you are traveling, for work, you don't have to worry, will my plan work the same in Austin, Texas, as it does in Seattle, Washington? And it does work abroad. So if you are traveling outside the country, not living, but traveling, then it will work, and it will be there for you as well. Some things with cost sharing that differs between insurance is how, and by the way, I'm not speaking for every cost share because there are hundreds out there. indipop only chose 3 companies to partner with, because they had to meet our strict criteria. So some of those were no annual or lifetime caps. So if you are interested in cost sharing, or otherwise known as health sharing, you will want to look at your plan. The fine print does matter, and see if there's a cap on care. So none of our plans have an annual or lifetime cap. The other is you might see that some of these health shares are tied to a Christian ministry. And that means they're going to have a statement of faith in their guidelines. And if you don't abide by the statement of faith, they can deny you care. So none of the indipop plans are partnered with a Christian ministry, not because we're anti-religion, but because well, because I'm Jewish and I couldn't join, I couldn't join one. And so it really was like, wait, I want to make a marketplace where it's open to, to everyone and not based on your faith. So no, we have not partnered with any Christian health share. So if you are, again, you don't have to come to indipop, but just for your education, if you're interested in moving forward with one of these cost sharing or health sharing, these are just things to look out for. And many of them come with a medical advocacy team. So this is a little different than when you're with insurance. You're more responsible for fighting a bill on your own if you're like charged twice, or you don't think that you weren't quoted right or pre-authorization, you thought you were going to owe this, but you end up owing that. Well, with the cost sharing, you have this team that is on your side helping you navigate and book appointments for you if you like, find providers for you. And in my case, last year when I was in the ER, they negotiated my hospital bill. And then 6 months later, the hospital called me and said, you never paid your bill. And I said, here's my Wells Fargo. Yes, I did. And they would not believe me. And I'm like, it's here, it's in my bank account. So I just uploaded my bill that the hospital gave to me, and I let my cost sharing plan fight for me. And within a week, it was resolved. And so they're basically, they understand. One thing I'll let everybody in on is there's actually something called the Healthcare Blue Book. And this is an actual book that has fair medical pricing for every zip code in the United States. So there really is fair, real pricing for an MRI in Omaha, Nebraska compared to Miami. It's not just like, oh, the hospital can make up these numbers. They can, but we can go back to them and go, the fair medical price or rate for this MRI in this zip code is 900. Why are you charging me 15,000? So there really are numbers. I think as Americans, we're kind of like, think about this, Nick, think about flying to see me in Arizona. And then when you get off the plane, that they'll say, oh, that was a $1,200 flight, Nick. Like, would you have taken it? Like, you're billed after the fact that you're like, oh, this is what I owe. I didn't know that. But we're kind of like grew accustomed to, oh yeah, like, I don't really know how much it's going to cost, or you think it's going to cost something, and then it turns out to be something else. So I don't know, how am I going to in the weeds here?
This is great. And to actually illustrate that idea of like, yeah, imagine taking a flight or staying at, a hotel or an Airbnb, and then it's like after the experience, they're like, oh, by the way, here's how much it costed. Like that's crazy. And it's unfortunate that our whole healthcare industry is the way it is, and we don't need to get too in the weeds on that, but it's crazy. And so maybe a question here, and again, hey, we want any of your questions, everyone, so feel free to type in the chat or whatnot. This we want to address them. But what would you say if there is maybe a biggest mistake on when you see people approach these healthcare options? What would you say is the biggest mistake? Is it just not reading into kind of the things you described before? But maybe explain on that a little bit.
Yeah, you don't know what you don't know. You don't even know what to look for, right? You just kind of trust, I think, when you get a healthcare plan or a policy, that it's going to be there for you when you didn't even realize what was in it. And it's because sometimes we just don't know what to look for anymore. And we don't think, emergencies are not planned. I don't think anyone has in their calendar, January 24th, I'm going in for an appendectomy. You don't know things are going to happen, but broken bones and emergency, by the way, appendix removals are one of the number one surgeries if you're under the age of 30. So, and when I talk to young people in their 20s, hey, I'm young, I'm healthy. I just need something for the what if I break my leg? What if, I get hit by a car, right? And there are some things that happen that are really unexpected that you want something in place to help mitigate, number one, surprise bills. Number two, that it's accessible. Almost everybody wants an accessible and affordable plan, something that's going to be there for them and not cost a lot of money, right? So we've seen virtual care completely blew up during the pandemic because most doctors were like, don't come in, don't sit in my waiting room. Let me call you. And now, oh my gosh, telehealth has gone through there's so many different telehealth companies. But what it's really great for is, yes, like there's 1,500 different conditions that can be diagnosed by just you and I talking. And a lot of times, while you're traveling, or if you have a little one and 2 a.m. and they wake up with a rash, these 24/7 virtual care, it is a game changer in your life. I've been using my virtual care more than I've been going in personally to see my primary care doctor. And it's been amazing because I don't have to use the driving time. I don't have to sit in a waiting room and be exposed to other people. And it's at the comfort of where I am. And I'm still getting the medication or the time with my doctor that I need. So if you haven't used virtual care, this could be something that you might want to explore. It can be part of your insurance. You have to check, like a Blue Cross Blue Shield probably now has a virtual care line, or it's definitely part of your cost sharing. I can tell you that all indipop plans have virtual care 24/7 in all 50 states. So a lot of times you don't know what to look for. You don't know. I have a cheat sheet of terms, like what exactly is a deductible. Then you need to know what your max out of pocket is, because you want to know, you don't want to go into medical debt for your broken leg, right? And this is something that I think many of us get nervous about, is if something does happen, how much will I owe? Just to give you an example with cost sharing, it is, at least with the indipop plans, you're going to spend $1,000 out of pocket for a surgery or a hospitalization, which compared to those $8,000 deductibles that I was quoted, I was like, okay, that's a game changer for me, because I mean, it's definitely more affordable to do $1,000 than it is to do an $8,000 surgery. So you might want to look at that as an alternative if insurance is just not fitting your needs, or you keep seeing these high deductibles. You can look at the cost sharing world and see if it could be a fit for your individual or family needs. One difference is, and this is also the flexibility, not only are they portable, but they are not based on employment status and earnings, which means you could be a 1099, you could be part-timer, you can have a company and offer it to somebody that works less than 30 hours a week. You can contribute $100 or you can contribute 100%. So it's very flexible when you're building your team. We have a lot of startups that are on our indipop plans because it's just more forgiving about the status of their people. They also, a lot of tech companies bring in people from other countries. And as long as you have a United States address or residence, for 6 months, you can help put somebody on, give them a quality healthcare plan.
Awesome. That was really helpful on all that. Lauren comes back in
Oh my
and
gosh.
yeah, so Lauren, thank you for sharing that. And, I think the question here is really around, hey, if someone has
Okay.
a
Condition. Yeah.
quite a condition that has become quite expensive from a healthcare aspect, Lauren's asking, like, because it's cost sharing,
Yeah.
would not be a burden to the entire community based on a very high level. So maybe describe that a little bit.
Yeah. So cost sharing is anyone can come and be a member of that community, but each cost share has a guideline. It's a look back period. So if you've been in remission for 2 years, we do have people that have had cancer and they came on the plan now because they passed the look back period. So if you're still in treatment, and the guidelines usually say if you're symptomatic or diagnosed, then for the first year, it wouldn't be eligible for that low $1,000 deductible. If there are exclusions, type 1 and type 2 diabetics that have not been hospitalized in the last year, high cholesterol, blood pressure, asthma. And we do have people that have thyroid conditions, but they've been on their medicine for years and they're like, as long as I take my medicine, I'm fine. So I let them know the risks, because that is considered a pre-existing condition. So unlike ACA, and by the way, it's still blurry to me because I was trying to help someone with a pre-existing condition in New York and we were running into roadblocks. We could find her an HMO, but it was really difficult to find her a PPO with a pre-existing condition in the state of New York. So the ACA guidelines for Obamacare was if you have a pre-existing condition, they cannot rate you up or deny you care. So the same thing is you can come onto these health shares, but for the first year, it's not, that condition is not shareable. So if you have, the examples I give is a chronic condition, maybe you were just diagnosed with Lyme's disease, or maybe you just had your ACL surgery. I would caution you for your ACL, make sure that you, are fully recovered before joining one of these cost shares, because if your ACL did not heal correctly, you came on with a pre-existing condition and therefore it's not eligible in the first year for that low 1,000. I keep saying low for $1,000, but compared to the other plans, it is, but it's still a lot of money. $1,000 is still a lot of money. So if anybody wants to talk to me about a condition or something that they're going through, we are very open and transparent. Hey, I think you should stay with insurance right now. It's a better option for you. We never want you to have a surprise, big medical bill.
That's yeah. Thank you for saying that as well. And I know that you treat your current customers and or potential customers with respect, and you don't want to put someone in a place that they maybe don't feel comfortable.
No, and if anyone in your community would like to book time with us and have your policy or a plan that you're looking at and say, what does this mean? We will do our best to try to decipher it and guide you. We are very honest. If we don't understand it, we'll let you know. And sometimes I really think they make it vague, because sometimes we're like, what does that actually mean? But we're here to help. We're not just here to say our indipop plans are the best. Everyone should be on them. That's not the case. Like I said, it's very personal, and what may work for one family may not work for another family. One thing I wanted to share about cost shares, one big difference is with the deductible. So in cost sharing, you might see an acronym called IUA, and this is initial unshareable amount. This is the amount that you're going to be responsible for before the healthcare company kicks in, just like a deductible. But unlike a deductible, here's the example I give. If you break your leg in December, most likely you're going to have physical therapy in January or February. And in insurance, your deductible would start over again in the calendar year. With cost sharing, you're not going to have to pay that $1,000 over again because you're in the same medical need. So as long as you're being treated consecutively during the year for the same medical need, if the calendar changes, you do not have to pay again an IUA or that deductible. So that's a big difference. The other difference is because it's one set transparent rate, if you are in an emergency situation, which again, I mentioned in the beginning, you shouldn't have to pay an out-of-network fee because it's an emergency. But when you're on a cost share, you don't have to worry about your anesthesiologist being contracted and not in a network, because you're responsible for one flat rate of 1,000. You let the health share or the cost share deal with the rest. You're going to pay your IUA, your deductible, and then they're going to deal with the rest. So that's, I think that takes a lot of stress off somebody when if they're in some kind of medical crisis. Somebody sent me an article that a mother had to, she had, her baby came early, and she was covered with her insurance, but the doctor that took the baby to the NICU and was overseeing the baby was not in her network, and it was a $12,000 bill. And I mean, these are the things that make you so stressed out. You're dealing with a baby that was born early, is in a NICU. You should be focused on that and not fighting it the article said she fought it for 3 years. Like, that's stressful. So these are things that I'm not saying healthcare is still healthcare. Like, just because these plans exist does not mean they solve the billing problem in the United States. There are so many codes and so many systems that have to work together. That is still, there's a lot of work to be done. And I'm not going to bash insurance, because insurance is a route to getting, your healthcare needs met. We're just saying, look, 99% of people don't even know these exist. Take a look. This might be a great fit for you.
Yeah. Yeah. Let's go back to the travel, and especially international. And no secret here, I travel internationally quite a bit, and been really blessed to do that for Founders Live and all of the good stuff there. But what should people consider, or if someone is on a cost share experience like this and they're international, let's just say they're in Europe, and something happens, what is the process, or how should they understand what's going to happen next?
Well, obviously, if it's life threatening, that's a little different than so I know somebody was in Barcelona and she rolled her ankle. So it wasn't life threatening, but she still needed medical assistance. The nice thing about European countries, especially Barcelona, it was like super cheap for her to go into a clinic. So I think what she did was uploaded her bill of like less than $60 or something. And, I think they reimbursed her for that, but it depends on what the medical need is. And then these plans, obviously, if it's life threatening, you had a heart attack, you broke your leg, once you're stable, that's when you loop in the cost share, and each cost share works a little different. So I can't say this is the procedure for every cost share, but like one of our cost shares, you would pay your 1,000 and then you would collect all of your bills and then send them in, and the cost share is going to deal with them. The other one is, no, you want all the claims to go to your cost share. You don't even want to see anything come to you. You're still going to pay your 1,000. So they all work a little differently.
I see. Well, it's good to know, and just get stable first, and then you're going to take care. Again, anyone thoughts, questions? It's an open room. Feel free to type them in chat, and we can address them. What how about this? And this is if someone is in another country, or you're listening to this, you're watching this later. Indipop is for the US population.
Right.
Do you have any suggestions for entrepreneurs that are in other countries where they should look? Clearly, this is only for people that are located in the United States,
Yeah.
but what are your thoughts on
No,
international?
each country is so different. And then I'll get people that their spouse is from England. Oh my gosh, my husband doesn't have to deal with this when we're in England. I'm like, I know it's just, this is our system. There is if you do live in the United States and you travel like 6 months out of the year, you might also want to look at global insurance. There is something that you can have. Usually they're high deductibles, but they could be pretty reasonable. 300 to 600 a month I've seen. But I did see a $10,000 deductible. So, I mean, that's the plan that someone shared with me. She's like, well, I live outside the country 6 months in a year. So I have to I said, okay. So, yeah, every country's different. So I couldn't speak for that, but if you are here and you're bringing someone in, this could be an option, like you have an IT developer that you're bringing in from another country, Israel or India. So, it could work where you can say, hey, we're going to contribute. I'll go over some pricing. Maybe people are interested. I don't know, but we have some of our plans started at $195 a month. And we have a family plan for $899. So compared to what we've seen for premiums out there, it could be a 50 to 70% savings. When I started this 3 years ago, the family premiums the average was $1,500 for a family to pay for their entire family to have healthcare coverage. And now fast forward 3 years later, and we're not seeing $1,500 anymore. We're seeing above $2,000. People have been sending me their healthcare plans with a rate increase of over 10% for 2024. Think about that.
Yeah.
It's a huge increase. I just get this. I mean, I'm glad indipop is around, but I just get really upset with, we should never be in this situation where we have families that can't afford their health care. I mean, it's just, and when I have to, say, hey, this isn't the best fit for you, I really feel bad, because I know what it's like to not have options, and that this is something that you're needed. I don't want somebody to come to me and say, I didn't call an ambulance when I was having heart palpitations because I was scared of what it was going to cost.
Yeah. So Lauren has another question, just kind of more clarification. Again, like, not having it, and then bringing in and actually having this literally $2 million expense, would that have hurt indipop? Or maybe talk a little bit about one individual having a massive bill, does that affect the larger community in that way?
So I'm going to give an example. I was just visiting one of our healthcare partners. They're located here in Scottsdale, Arizona. And he gave me an example of one of the members wanted to have, like, I think it was a knee replacement. And one of the hospitals that this healthcare company was negotiating with they said, oh, it's a $50,000 surgery, and we're going to give you 50% off if you pay cash right now today. And so the member was like, do it. It's 50%. He's giving us 50% off. And the cost share was like, it's a $12,000 surgery. They just upped it and then, reduced it. And it's still more than what it should be. So that 2 million, I'd like to know, is it really 2 million? Because when we really dig into the numbers, it's not, that's what they're billing for. So would it hurt indipop? No, these companies are designed to have an idea of if they bring on 1,000 people, how many babies are going to be born, how many diagnoses, how many heart attacks. And so the rates and everything are adjusted accordingly. I'm very proud. Like I love my healthcare plans that we partner with. In 2 years, they did not raise rates. Insurance has raised rates every single year. 2 years, they did not raise rates. They're only raising their rates 4.5%. So they really have a good idea and they manage the fund accordingly. So I wouldn't look at it as, oh, I had this terrible, dreadful disease and I hurt the population. No, you are part of the community. They care about you, and their goal is to get you the best care at the right price. And we did have someone that had that was on the plan that had to have emergency surgery. Then they found out she had cancer, and she got to choose. She wanted to go a holistic route. With this particular cost share, they actually have naturopaths that are medical doctors on staff, and they matched her with a holistic oncologist. And as long as it's usual and customary for the cancer treatment, it's fine. If you want to go through an alternative treatment and it's not a usual customary plan, they might say, hey, this is what will contribute to it, but it's not, just like with insurance, it's not a proven thing, you don't qualify for it. So there are eligibility things for trials and things like that.
Yeah. Yeah. So these are good.
Oh,
Yeah.
stem cell transplants. Yeah. So this is very interesting that you bring that up, because we partnered with Top Doctor, which is a magazine and clinic in Miami, and they are doing stem cell banking. And you don't have to leave the country to bank your own stem cells. So if you're an athlete that gets injured, or like in the next, like your family history of having hip replacements or knee replacements, you might really want to look into banking your own stem cells for the future. It could save you an invasive surgery. So they're doing more of that in the United States now.
Interesting.
Yeah.
Lauren, yeah, thank you for sharing all this. And they're just helpful thoughts and questions. So good. So for a few of you that have joined recently, hey, we are taking questions through the chat, and if you're interested, and don't be bashful if you ask a question that maybe we covered before, it's okay.
Yeah.
And I kind of we're gonna go down a bit of this road, just kind of curious from your standpoint, what so many things you've learned around this, but what pops out of, and you can take this as like a founders, like an entrepreneur direction or a healthcare direction, but what have you learned in this process, especially building in this direction of healthcare? Like, obviously there's so many, but what pops up to you that you're like, yeah, crazy, never thought I would have, known this or discovered this in the 3 years previous that you started?
There's so much. Healthcare there's so many layers, and there's so many people that are involved, and there's a lot of systems now that we're moving more into technology for things. How many go to their doctor's office and they actually stand up and go to files anymore? Nick, do you remember that, where you would go in and they would look for your alphabetical and pull out a chart? Like, they still have some, maybe some paperwork to do, but how many do you go in and you see a tablet now? They're taking, they take all your information in a tablet. So if you think about all this information, that is being put into these systems, and then codes. And if one code is wrong, your whole billing is off. But there are times, like, I think what has surprised me the most is how many times people have called me and is like, well, this is what happened to me when I had surgery. And it just is so scary to think you're paying a lot of money monthly and it wasn't there for you. Or I had one guy, he said he was going to pay cash for his surgery, and he was quoted $3,500, and afterwards they're like, well, it's more expensive than we thought, we doubled it. I was like, what just happened? So as much as I think medical doctors want to practice medicine, I read some statistic that over 40% of medical doctors spend at least 20% of their time in paperwork. I don't think any doctor went into medicine to do paperwork, right? And I think there's a lot of restrictions sometimes about what you can and can't do when you have an insurance policy. The doctor is then going, oh, okay, you have this. Yeah, this medication is not covered, so I have to put you on this. And that is, you want the best care possible. So I think, as I said in the beginning, people want accessible and they want quality. And if the healthcare system, if we can design that, we start over, like, I don't know how to
Yeah, I wish
build
we
it,
could
but
do
I
about.
can't solve it on your podcast or on this show, on this today. But we're really trying. We're really trying to help people get the care they need at the right cost.
Awesome.
Yeah.
Yeah. And you're doing a good job. You're doing a good job. And, kind of going into, some last questions here. We'll close up here soon, everyone. And this has been awesome. Indipop information is in the chat, and it's indipop.co.
Mm-hmm. INDIPOP.
Yep.
Yep.
Where let's go out. Where do you want to take your company, Indipop? Let's go out 5 to 10 years. Like, what's the longer direction here? You are making impact with people. You're bringing something to the market and kind of solutions for especially independent population. But maybe walk us through, like, what's the further vision here, or where do you see in 5 to 10 years? Where do you want the company?
Yeah, so we have been working with practitioners, which was never my go-to market strategy, working directly with medical practices, but they started referring patients to Indipop. And so I've met with a couple of the operations and the front, what do you call it? For office managers. And they said, we really love working with your plans. It's an open network, we get paid faster. So I see us working more with practitioners. I would love to be known as the healthcare plan practitioners and patients love. We're also working with large communities that serve self-employed people. So we started with some really great partnerships of communities that have 10 or more thousand people that are self-employed. And they usually put us into their marketplace so that they can go into their own community's marketplace, and Indipop is listed for healthcare. But people have been starting to come to us and say, okay, great, you have healthcare. What else you got? And I think once you start to build trust, people are like, what else can I get from you? I am a self-employed person. So we did partner with a 401k company, if anyone's interested. And Nick, I mentioned we have some promos, so maybe we'll put an email together or where people can access. But 401k as a self-employed person, if you're not in a company where they're giving you all your benefits, this is something that really makes sense. Self-employed people need to save for retirement too. So that's where we're just creating more and more partnerships, and we're going to expand, I think, the resources and really just continue to help people, regardless if they're going to come through and buy or purchase or enroll in an Indipop plan, that we're able to provide value for that person.
Well, that's so great. That's so great. And I love the direction here. It's been fun to watch you. We've known each other for a while.
Yeah.
I am a customer, so no secret there. I've been utilizing Indipop for a while now, and it's been helpful, incredibly helpful in this journey that I'm on. So I just encourage everyone, consider it, look at it. If it fits, great. If not, no worries. But it's been helpful for myself as well as we share this with the community. So thank you so much for what you do.
Oh, you're so welcome. Just a side note, eligibility is 18 to 64 years old. So for cost sharing, 18 to 64, once you're 65, you're a Medicare person, all 50 states. So, and you don't, it's not based on employment status. So if you're thinking of going off of your COBRA or you're building your team, these are really great flexible options.
Thank you. All right. This has been helpful. Yes. Thank you all for being here.
Thanks, Lauren. Yeah.
Yep. And hey, everyone, we do every couple weeks now, currently, we are holding these Founders Live conversations. So, look for the next one. You'll get information around that. It's, let's see, it's finding your cloud advisors. And so that's going to be another great talk. So look at that. But, Melissa, thank you so much. Indipop.co. And thank you for just general healthcare thoughts and education. This has been really great.
Yeah, not something that I know that people really want to tackle, but thank you, Nick, for making the space for it. And thank you for launching Founders Live. Big fan.
Appreciate it. All right, everyone. That is it for today. And enjoy this. If you're watching this later, it's nice to see you. And thank you all. We will talk to you all later.